healing journey starts with listening. There's been a long history, unfortunately, of women not being believed in many aspects of our lives.
Hi, welcome back to the channel. My name is Molly, and today at Live UTI Free, we're chatting with Dr. Leah Posthuma and Aubree Ng. If you're new to our channel, be sure to check out the description below as we've linked to other resources that you might find helpful. Lastly, if you enjoy these videos, think they're important and want to support what we do, be sure to hit subscribe and tick the bell so you get notified when we post new videos. And other than that, we hope these videos provide the insights you need to take the next step on your UTI recovery journey. So joining us today are Dr. Leah Posthuma and Aubree Ng. Welcome and thank you for taking the time to share your experience with our community.
Thank you for having us. Thank you so much for having us.
Thank you. Before we dive in, we'd love to hear about your story. Could you each tell us about your background and what ultimately led you to specialize in recurrent and chronic UTI?
Yeah, so I'm a urogynecologist. I have been treating complex pelvic floor issues with Aubree for over a decade. And so in my professional life, I have a background in biochemistry and basic science research in the innate immune system of the bladder, and really love the field of urogynecology. In my personal life, I also have an interest in wellness and nutrition and movement and meditation as ways that really help me feel full and nourished and vibrant so that I can show up the ways that I want to in my life. And about 5 years ago or so, I started thinking like, gosh, what would it be like if I took these two aspects of my life that I'm really passionate about, this like wellness in my personal life and women's health, and combine them? And as I started sharing with my patients the things that I was learning in my own life, I was really surprised at how intrigued patients were and wanting to know. And so as we started to treat women who had urinary tract infections through a metabolic health lens and a lens of dysbiosis, we were getting a ton of traction. And that's how the UTI Clinic was born.
Leah and I share this vision of creating a clinic that kind of really reshapes the way that we think about UTIs and the way that we treat UTIs. And we also just really wanted to build something from the ground up that felt rooted in empathy and holistic care, and which is really, foundational to my practice as a PA. So I've been a PA for over a decade in urogynecology and urology. I have a background in molecular and cellular biology and spent some time doing basic science research kind of earlier on in my career. And in my personal life, I've always been really drawn to creative pursuits and working with my hands and just thinking creatively about how to solve problems. And I think that's one of the reasons that I was so drawn to working with patients with recurrent and chronic UTIs and find the work so interesting and just really fulfilling. But I also really started to recognize over time, there were just a lot of ways that we were coming up short in treating patients with UTIs. And at some point in my career, I took a step back and had to really kind of examine the broader systemic ways that we're shaping this type of care for women.
That's really interesting to hear how both your journeys have led to this and ultimately the UTI Clinic. And there's definitely a need for that empathy in this space as well. I think you touched on this a little bit, Aubree, but I'd love to know, how has your professional training and your personal experiences shaped the way you approach UTI care today?
Yeah, I think the world around us is so chaotic these days. I feel it. I know that our patients feel it. And I know we both really were starting to see the impact that was having on patients. And I think, in creating this clinic, I really, and sort of in my approach to taking care of women with UTIs, I think it's so important to validate that and acknowledge it. And then to also create this environment of safety where patients can feel like they can really set it down. And we both experience that feeling from patients of this sort of sense of relief of like, you don't have to carry the entire burden of everything going on around you on top of trying to kind of manage every aspect of your this chronic condition. And then, I think for us as clinicians, the chaos of the world combined with the pressures of healthcare, it's really challenging sometimes in clinical practice. And so we feel so incredibly privileged to be in this space where we can also kind of set some of that down and focus back in on why we came to this work, which is really to take care of people and connect with patients. And by doing that, I think it just really fosters in us this ability to think creatively and be a little bit more innovative in our approach to how we treat this problem.
Yeah, I think that's really important. And it's, like you said, for both the clinicians and the patients. So, with that in mind, how do you typically approach UTIs and how do you engage in conversations about them with patients?
Yeah, so we believe that every healing journey starts with listening. There's been a long history, unfortunately, of women not being believed in many aspects of our lives, but it's particularly important in our health and in our bodies. And so we want to listen to a woman's story, her history, where she's been, what she's tried, understand her lifestyle, her health patterns, her family's health patterns, to really get a full picture. Every time a urinary tract infection happens, there's a reason. And sometimes that reason is simple and sometimes it's pretty complicated. And so by understanding where somebody's coming from, that can help give us clues into why that's happening. And then we really feel like our role here is to stay abreast of all of the incredible research that's happening in this field so that we can then disseminate that to the patient and help share the load. When people, as Aubree alluded to, when people have been having especially frequent urinary tract infections or any type of chronic condition, they often feel like they're the one responsible for managing their symptoms, or they have to come to their clinician with stacks of journals and diaries and test results and what they've tried and what they haven't and their latest research. And we really want to take all of that so we can share the burden of responsibility with a person so that the person, so we can kind of be the keepers of the knowledge and teach that to patients, of course, to collaborate with the patient, but they can then focus on their healing. So that's what we try to do when we're working with people in our clinic.
Yeah, definitely. We hear from a lot of individuals in our community about the burden of self-advocacy and the added layer of stress of managing UTIs on top of symptoms. Are there any common misconceptions you find yourself addressing in the area?
Yeah, I mean, I think the biggest misconception that we see time and time again is this idea that women are at fault for their UTIs or their chronic illness, just kind of by virtue of like our anatomy or our habits. And there's this sense that, women kind of show up with this feeling of like, oh, I could have been doing this better, or maybe it was because of this or that. And yeah, we'd really like to not focus on that. I think that's historically how women have been, how we've talked about UTIs with women.
Interesting. And I think a lot of individuals can resonate with these points as well. So, testing is such a central part to all of this and something our community has a lot of questions around. Leah, could you perhaps describe your overall testing approach when assessing someone for a suspected or recurrent UTI and the types of tests that you typically use?
Yeah, absolutely. So the way that we approach a UTI is we don't think a UTI is just something that kind of randomly happens to your body. It's your body giving us information, signaling to us that there's something happening. There's a reason why an infection happens. And so what we try to do is we try to understand the underlying reason. We think that there are a handful of underlying patterns that make it more likely that people find themselves in the, especially for women who have a pattern of frequent urinary tract infections. And so we use, of course, a patient's history and a physical examination, but we also use testing as well to help to understand that. So in terms of urine testing, we typically use molecular testing based on the patient's particular history and symptoms, but that's generally where we go with for the urine testing. But then we also want to look at the health of the microbiome of the colon and the bladder because we think that can play a significant role in some individuals. We use metabolic testing with labs, saliva tests, and wearables because for some folks that will be a clue as to why they're getting frequent urinary tract infections. Other folks probably genetic contribution, and so then we would look at their DNA to see why it's likely that they're finding themselves having frequent urinary tract infections.
You've touched on some of the advanced testing methods there. How do PCR and microbiome testing help shape a patient's treatment plan? And what does it add to our knowledge on UTI testing compared to more traditional methods?
Yeah, we are in such an exciting time in medicine right now, especially as it relates to the human microbiome and our knowledge of that. We know that the microbiome plays a significant role in our health and disease processes, and we know, we're starting to kind of better understand its role in cardiovascular health and mental health and reproductive health and certainly the health of the bladder. The bladder has its own unique ecosystem of organisms called the urobiome, which is plays a critical role in keeping the bladder healthy and preventing infection. And as Leah had mentioned earlier, we're really committed to kind of staying abreast of the most current scientific research so that we can translate that cutting edge research to clinical practice.
Let's say a patient presents with symptoms that are indicative of a UTI, but previous testing has been negative. You mentioned that you often use PCR testing in these situations. When you review a PCR report, what aspects of the results are most important to you, and how do they inform your treatment?
Yeah, that's a great question. I mean, I think that first, just to say first that it's so important to listen to women and to trust their stories and to take their history and story as part of the clinical context. And so when women come to us with this history of feeling symptomatic but having negative cultures, we find it really helpful to do molecular testing. And the reason for that is there are non-infectious etiologies for lower urinary tract symptoms. But when you get these negative tests, it's really hard to understand, is this non-infectious or are we relying on an outdated test and perhaps we're missing something? So I think if a woman is telling us, I am having these symptoms and they sort of repeatedly get dismissed because their cultures come back negative, right? The first step is doing molecular testing. And yeah, I think that as we understand the urobiome more and more, molecular testing kind of gives us a window into what this complex ecosystem looks like. And so I think that's going to be kind of ever evolving too.
And how do you weigh the PCR findings against the patient's symptoms history, especially given that PCR only screens for a limited number of organisms?
Yeah, as Aubree mentioned, that is something that is our understanding of what health looks like in terms of the bacteria that should ideally be in the bladder is continuing to evolve. And fortunately, we're living in a time where there's some really interesting and exciting work happening in that area. In addition to PCR, we also use next generation sequencing for certain individuals. But any test, be it is only has its limits. So a test is only as good as the question that you're asking of it. And so that's why we, instead of relying on like one piece of information, we try to back up and look at the all of the insights that we have into that patient, into that episode, into what's happening for a person.
And given that approach, what does treatment look like? Can you talk us through the types of treatment you typically use for recurrent or chronic UTIs?
Yeah, so I think, when you sort of step back and think about the underlying mechanisms as to why somebody might be getting these recurrent infections, it really helps to inform your treatment, your workup and your treatment. So, for example, a patient with microbiome dysbiosis is not going to be a great candidate for long-term antibiotic therapy and might be better suited for something like methenamine or herbals. And I think taking that step back gives us access to kind of a broader range of therapeutics too. So we offer not just antibiotics and methenamine, also things like D-mannose, bladder installations, herbal therapies, and estrogen. So, and then, you know, also addressing underlying causes of recurrent infection. So addressing metabolic health, and addressing the microbiome. And then I think in addition to that, it's really important to think about ways to help women kind of reconnect with their bodies, and calm their sympathetic nervous systems. We talked about the chaos of the world a bit, and I think that's a huge part of healing for women. So we talk a lot about, you know, re-engaging in things like joyful movement, being in the outdoors, nourishing your body with foods that you love, having community, all of these things that I think help set women up to this path towards, you know, real healing.
Are there any particular herbal or integrative therapies you found helpful for patients with recurrent symptoms?
Yeah, I'm actually getting a master's degree in herbal medicine right now, and it's been really exciting to learn about the powerful antimicrobials that exist in botanical medicine. There's a lot of fantastic herbal products that are out that are available on the market already, but they tend to be broad in general, which is great for some people. But one of the things that we are really excited about offering in our clinic here and working with are formulas that are specifically targeted to the uropathogen or uropathogens in the case of a polymicrobial infection. And so what we do is we look at the specific bacteria that's causing or bacteria that are causing your symptoms, and then choose a formulation that addresses the virulence factor of that uropathogen. So be it biofilm formation, anti-adhesion effects, or resistance patterns, we can build a formula specifically around that for an acute infection or a flare. We're also using herbal therapy to treat the pain associated with this condition, both acute pain while we're awaiting testing results, and for people with more of a chronic type of picture, the chronic pain that can impact people as well. And then we are also using herbal formulations to help to restore bladder health, like in a post-UTI syndrome where most of the pain is coming from inflammation rather than acute infection, or in patients with more of a painful bladder pain syndrome type of a picture.
And how do you make that call? What factors help you decide whether to use herbal therapies alone or alongside antibiotics?
One of the things that I'm most excited about our clinic is our acute care pathway. So when we were building the clinic, we took a step back and to try to understand where the real clinical work happens when we're deciding on treatment especially for an acute episode. So women know when they are symptomatic. And so we set our patients up with at-home molecular testing. So as soon as they become symptomatic, they can take the test, mail it in, and then a day or two later, we get the results back, they meet with us, and we go through then the options for treatment together. So we decide based on what their testing shows, their history, their goals, where they're at, and then make a treatment plan, be that herbal antimicrobials, antibiotics, sometimes a combination of both, or sometimes even supportive factors, or toggling these other areas in their life that we're working with as well to get to the underlying pattern of the reason why they're getting lower urinary tract symptoms.
I know, I think that's really important. And that immediate pathway, like you say, to treatment, it's essential in helping patients with their symptoms when they're struggling. So we've found that a lot of individuals in our community often feel dismissed when seeking care for UTIs, sometimes due to factors like negative test results or stigma. How do you ensure that patients are prioritized in this process?
Yeah, that's such a good question. Thank you for asking that. I think, you know, UTIs take an incredible emotional and physical toll on women. And when we built this clinic, we knew we wanted to prioritize women and thinking about how best to offer care for them. I think when women, you know, feel repeatedly overlooked or dismissed, they kind of develop these defense mechanisms just to kind of access the care that they need. We really knew that we wanted to make bladder health feel worthy of dedicated attention and care and send this really clear message. It's one of the reasons we're called the UTI Clinic, just so that we can make it really clear that this is the place to be for that. And I think that we're just so excited to be part of this growing movement of women that's standing up and asking for more and really demanding more. And I think it's the right time for that. We have this, we're in such a unique position to be able to translate these stories that we hear every day in our practice in order to advocate for women, to close gaps in research, to offer better therapeutics, to really listen to women and provide care that feels empathetic and trauma informed. And I think, our patient is always our priority in that. And I think I can speak for us both when I say that we're just so excited to be doing this work and caring for women in this way. And it just feels really special.
No, that's great. I think centering patient voices is definitely needs to be a priority for the future. And finally, what is the best way for patients to reach out to your practice to learn more or book an appointment?
The best way to do that is through our website, which is the uticlinic.org. From there, you can learn more about us and what we offer and book an appointment through the website. We are licensed in California, Washington, and Oregon, and so we can see patients virtually from there or at our in-person clinic in Portland, Oregon.
Is there anything that you recommend patients should do to prepare for their first appointment? Anything helpful to bring along?
If you decide to book an appointment with us, we send you a tailored questionnaire that should be enough to get us started.
Perfect. Well, thank you both for coming to this interview. We really appreciate you giving the time to our community. I will add all of your details about the UTI Clinic into the YouTube description of this video for anyone who would like further details. Thank you both.
Yeah,
Thanks for having us.
Thanks so much for watching. I hope you found this video helpful. You're always welcome to reach out to us for more information about clinicians who specialise in recurrent and chronic UTI. Our contact is in the description. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveuti3.com for other articles on recurrent UTI treatment options. Of course, if you like what we're doing on this channel, make sure to hit the subscribe button here on YouTube and tick the bell so you get notifications about future videos. Thanks so much for joining us for our Clinician Insight series. If you have suggestions for who we should interview next, be sure to drop us a comment.